Good afternoon, everyone. Thank you for joining the Maumee Bay Club today as we present our Let's Get to the Heart of Things program. Today, you'll hear lots of great information that's going to help us all stick around a bit longer and have excellent heart health. Get ready to enjoy, hear new information, and be sure to ask your questions. Next up, we'll hear from Natalie Edwards, our MC for the day.
Good afternoon, everyone. Thank you very much for joining us. Thank you, President Crystal, for opening us up today. It's my pleasure to welcome you all and hear some valuable information. I would first like to start off by thanking our sponsors for this program, New Perspectives Sober Living and ProMedica Health. It is, I would also like to let you guys know, be aware that we will be monitoring the chat. We will be doing some did you know tips in the chat and engaging with you there. So please feel free to utilize the chat and partake of some helpful tips as we go through this. It is my pleasure to introduce to some and present to others and read the bio of Sister Arlene Bond. Sister Bond was born and raised in Toledo, Ohio, to Raleigh and Loretta Ford. The youngest of 8 children, Arlene has 1 son, Michael Lavelle, and a lovely daughter-in-law, Brittany, and 2 amazing grandchildren, Michael Jr. and Brielle Dior. Arlene is very engaged an active member of New Life Church of God in Christ Incorporated under the leadership of Bishop Edward T. Cook and First Lady Sheila L. Cook. She serves in many capacities, but is most known for her work in the Mission Corps team as president and fellow co-laborer. Additionally, for more than 13 years, Arlene has served as the president for Ohio North First Ecclesiastical Jurisdiction Women's Department, Home and Foreign Missions. In this role, she oversees the outreach ministries for over 100 churches. She is the author of A Ministry Guide to Outreach. This book has been used internationally by missionaries to help in their evangelism efforts around the world. Professionally, she is a 39-year registered nurse, veteran, as well as a regional instructor for advanced cardiac life support and pediatric life support, teaching all disciplines of healthcare, including board-certified medical physicians. She holds certification in trauma and advanced life support. Her professional affiliations include past president and current member of the Catholic Honor Society of Gamma Phi Gamma, as well as active member of several other honor societies and groups. Also a member of the Maumee Bay Club, NAMBPWC Incorporated. She is also the owner and CEO of New Perspective Sober Living, LLC. Having said all of the above, Arlene is most all a lover and follower of Jesus Christ, in which her aim is to be more like him every day. She strives daily to live a life of intention as she follows her core values of holiness, focusing on family, living a life of integrity, and being proactive and consistent. It is my pleasure and honor to present to you Arlene Ford Bond.
Thank you, Sister Natalie, for that introduction. And thank you for welcoming our guest today. And I want to also give a personal welcome and thank you for joining us. I am so excited that we, and I say we, because in doing my research and looking for best practice and the new updates and guidelines, I learned some things myself that will help me keep my heart healthy. So I'm excited again that we have taken time out of our very busy schedule to prioritize our health, specifically our heart health. Next screen. Next slide. Here, thank you. As far as our agenda, we're going to go over what our objectives are for the day. We'll talk about hypertension / HBP, which is high blood pressure. You may have seen this on, if you take over-the-counter cold medications, you will see HBP. And this is what they're saying, that that particular medicine is safe for patients or customers with high blood pressure. That was just an aside on that acronym of what that means. So be careful when if you have high blood pressure, just be careful when you're getting those over-the-counter things, so that you look for those initials, and that is saying that it's safe for you, because lots of those medications will constrict or tighten the vessels and cause hypertension to worsen. So as my pastor often say, that was a freebie, that was an aside on the agenda. We'll also talk about congestive heart failure. We'll talk about risk factors and how to decrease those risk factors. We'll talk about atherosclerosis, which is hardening of the arteries, and we'll get a little bit more involved in that, as well as nutrition and how to read labels and how important that is. And we'll also end with some resources. Now, before getting into the meat of all of this, I do want to give a little bit of a disclaimer and let you know that anything that we discuss today is for the purpose of being an assistant to the things that you and your healthcare provider have already set for your personal plan of care. It is by no means intended to substitute or replace what you and your doctor have already come up with for your plan of care, but rather to equip you with some practical tools and perhaps even spark some questions for you to take to your next appointment with your doctor to discuss further. So in reviewing those objectives, we're going to define hypertension, high blood pressure. What does that mean? We're going to define atherosclerosis. We're also going to define and review risk factors and how to decrease those risk factors. We'll discuss label reading. We're also going to talk a little bit about the correlation between high blood pressure and stroke, discuss some warning signs, review the national guidelines for blood pressure, and provide you with some community information. Next slide. So for our first definition, hypertension. What actually is hypertension? Hypertension. According to Mayo Clinic, it is when the force of the blood against that artery wall is too high, okay? And that's a very simple diagnosis of hypertension. Normal blood pressure, it used to be different, but according to American Heart Association, it is less than 120. If you can remember that number, 120/80 has been the norm in people's mind for a very long time, 120/80. We'll talk about the new norms on the next slide. Also, blood pressure has two numbers, and I'm sorry if I'm being very basic, but I want to make sure that I explain very clearly what blood pressure actually is. The systolic, which is the top number, we as healthcare providers explain that as the working part of the cardiac cycle. The cardiac cycle is a two-part cycle. So the top number, which is why it's higher, that number is generated at the beginning of the cardiac cycle. The bottom number is generated at the end of the cardiac cycle, which is the resting part of the cardiac cycle, right? So with that being said, as healthcare providers, we get a little more nervous when we see the bottom number outside of the range, because if the number at the top is high, okay, that's when the cardiac cycle starts, that's when it's working. But if it's still working too hard when it's supposed to be resting, then the heart doesn't get any relief during this cardiac cycle. When it's to be resting so that it can start another cycle, because your pressure is too high, then it never gets that rest. And so that's when problems happen, which we'll talk about later, the atherosclerosis and hardening of the arteries and different things that high blood pressure complicates. Is generally more because of that bottom number. Yes, the top number as well, when we look, because we look at the whole, but when we are really concerned is when the bottom number is out of range. It's called the silent killer. Why is that? Because hypertension doesn't hurt. You can have hypertension and not have pain, not know that it's high. So how do we know? How do we control it? How do we get ahead of the game and not let it kill us silently, if you will? The way to do that is to consult with your physician, get a normal range for you. Make sure that you're checking your pressure at home. If you are on blood pressure medication, it doesn't suffice to have your blood pressure checked only when you go to the doctor. I mean, think about it. That's why it's killing people, because we think no news is good news. Well, the news is there, you just haven't read it. So you need to know your numbers. You need to keep an eye on it. Blood pressure cuffs range from $40 to $120. Most insurances cover that. And even if they don't, I do not recommend the wrist cuffs, just so you know. That is a personal, there's no data behind it, but I have not had good results and consistency with wrist blood pressures. So a cuff that goes over the upper part of your arm, make sure that the cuff size, you can consult with your physician, the cuff size needs to be appropriate. If the cuff is too small for your arm, it is going to give you an abnormal high blood pressure. If the cuff is too big for your arm, it will give you an abnormal low pressure. So it is inaccurate if the cuff size is not appropriate, and you can get the appropriate cuff size by consulting with your physician, which is the last part of this. It's consult with your physician for individualized pressure goals. Now, why did I put that there? If you have had hypertension or high blood pressure untreated for an extended amount of time, your organs are accustomed to that higher pressure. So if you lower your pressure too quick, you can actually have a negative impact on the rest of your organs, because the organs are used to a high pressure, and without any warning, we've brought that pressure down to what American Heart says is the national norms, and we brought it down too quick without any warning for those organs to get used to the lower pressure. So that's why I said at the beginning in my disclaimer, this is very important information, research-based, best practice. However, to be a good clinician, we have to individualize our care. It is not one size fit all. So you need to be under the doctor's care when you have high blood pressure and come up with those individualized goals, and the way and the rate in which you will and the doctors will lower your blood pressure. Next slide. So this is the chart that I was speaking of that we'll delve a little bit deeper. It's pretty self-explanatory as far as the colors. You see the green and the yellow and the red, but what you also see are two different variations of oranges in between there. So it tells you that normal blood pressure is less than 120 for the top number, the systolic number, and less than 80 for the bottom number. Now, years ago, that yellow zone, which says elevated, we knew that to be normal. What has happened over time, American Heart has taken research, looked at outcomes of patients with high blood pressure and the disease process that blood pressure has impacted. And what they saw was that even people with blood pressures 120 to 129 with a bottom number of 79, they were still having kidney disease, they were having atherosclerosis, they were having strokes. And so they lowered that actual guideline for normal blood pressure. So that's why they say less than 120 over 80 is normal. You're elevated now where it used to be normal. You're elevated if your pressure is 129 over 85, okay? And then we get into the stages of high blood pressure. So hypertension stage 1 is when your pressure is between 130 and 139 for your systolic or your top number, and the bottom number is between 80 and 89. And I know, and hopefully this does startle some people, because I hope that one of the major goals for this presentation that I said to myself as I prepared, I said, if I can startle one person into making some behavior modifications that is going to give them a healthier heart, then this presentation will have been a success. It is not the number of people that sign on. It's not how I speak. It is really to trigger some concern, if indeed concern is appropriate for you, to make some notes to take to your doctor and say, okay, I want to get ahead of the game. So that 130 to 139 over 80 to 89 is considered hypertension now. 10 years ago, it was not. It is considered hypertension. So it is stage 1, but it is still considered hypertension. So what is stage 2 hypertension? That's a different variation of orange. We're not red yet, but we are still hypertension, and it's stage 2, because now your blood pressure is 140 or higher over 90 or higher. So that's when, hopefully at this point, you and your doctor definitely have a plan to lower your blood pressure. And then hypertensive crisis. These are the patients that we see that come to the intensive care, and they need to be on IV blood pressure medications emergently to get them down to prevent a stroke or a heart attack. And that's when your pressure is higher than 180 for the top number, the working number, and then your resting number is higher than 120. That is when and it tells you there, consult your physician immediately. Okay, next slide. So before starting here, I do want to ask Natalie. Natalie, are there any questions in the chat before we get into congestive heart failure?
Yes, as a matter of fact, we do have an item that Frankie Young listed for the parking lot. I believe she's asking about fitness trackers and the accuracy of those types of devices.
That's funny. As I was preparing and as I was speaking about not recommending the cuff, the ankle, the wrist ones, I was going to say a little bit more about those, but the data out there is so varied. What I will say with any blood pressure monitoring, consistency is most important. If I take a patient's blood pressure in their right arm at the beginning of my shift, and then I'm checking it throughout the shift, I'm taking it in the right arm with the same cuff. Consistency is most important. Those tracking devices, again, a lot of them, marketing, it plays a huge part, as we know. Just recently, I had a family member take their blood pressure through one of these tracking devices, and then I took their blood pressure, and it was like 30 points off. Rule of thumb is if there is a variation of more than 10 points, then it is not accurate. That device isn't accurate. So my recommendation, and this is not in literature, but my recommendation after being a nurse for 39 years and over 30 of those being in critical care, I would do a compare and contrast. I would, at the very same time, take your blood pressure with those tracking devices, and then take your blood pressure the traditional way. And if the numbers consistently, not a snapshot, if you are consistently getting more than a 10-point difference, then it is not appropriate and it is not accurate.
Thank you very much. We have an additional question. What are the physical symptoms when in the last stage of HBP or high blood pressure?
What generally happens there, again, you have to be under the care of your doctor, because remember, high blood pressure is silent. So you may not feel pain, you may not have a lot of symptoms, but your doctor will pick up on those things, because what generally happens is those arteries are so tight that your other organs are starving for oxygen, because oxygen is carried by the choo-choo train called blood. And the blood does not get to those organs if the vessels are tight. which is what hypertension is. The vessels are hitting the wall very high, very hard, and they tighten things, and that's when plaque builds up. So it doesn't just target the arteries in your heart, it targets the arteries all through your body, because your body is a whole, one whole being. So some of the subtle signs that happen is, and we'll get into it when we talk about congestive heart failure, but some of the things that happens is you don't get enough oxygen to your lungs, and so you have some shortness of breath. Your left ventricle, which we'll talk about with this slide, your left ventricle gets a little stiff or it gets floppy. And so it's not pumping blood out the way it should. And so you're retaining fluid. And so the fluid retains path of least resistance, which generally is your lung or your peripheries, are your ankles. So you'll have some ankle swelling. If it has gotten to the point where you have ignored it and not treated it for so long, it could impact your kidneys. And so your kidney numbers will be up, but you won't know that by feelings. You may notice that your urine is a little dark, or there, less urine and things of that nature. But you really need to be under your doctor care, because it can't be a snapshot. They'll hopefully get to it before it gets to that point. But those are some of the things, because your blood pressure being high impacts the heart's pumping ability, and the heart pumping ability is going to impact all those other organs that it should be feeding. Does that answer the question? If there are follow-up questions to the questions, please put those in the chat. If we have satisfied that answer for you, put that in the chat as well, because we want this to be useful information for you to have a healthy heart.
Thank you so much.
Sure. Anything else, Natalie, in the chat?
That is everything. Frankie said, thank you, that was great. So
okay.
All the questions thus far. Thank you.
Okay, awesome. Thank you. So we just went over some of that as we answered the question, but I want to delve a little bit deeper into what HBP, the effects on the heart. So we talked about atherosclerosis, which it causes the heart to be ineffective as a pump, is basically hardening of the arteries, because the arteries have been beaten up. So they get hard. So it's almost like the people that put up a fence and they get hard. When people beat up on them, talk down to them, they harden, right? They've been beat up, so they harden. That's basically what happens to the arteries. When the high blood pressure beats on those vessels so much, the vessels harden. And if they're hardened and non-compliant, then they won't pump the blood effectively. The second thing that happens is oxygen to the lungs are decreased. And when that happens, then you get short of breath, which is what SOB means. You get short of breath. So that is the second impact of high blood pressure on the heart. The third is congestive heart failure. And with the next slide, we'll delve a little bit deeper into what congestive heart failure actually means, the two types of congestive heart failure, and how that is impacted by high blood pressure. The fourth thing is that it decreases the blood flow to your heart. And so what did I say carries oxygen? The choo-choo train called blood. So if the blood doesn't have enough oxygen going to the heart, then you will more than likely have chest pain, which is also called angina. So those are the impact of blood pressure being elevated, untreated on the heart and the body. Next slide. So congestive heart failure. This slide, I know you're probably thinking, okay, I'm not a nurse, I'm not in healthcare, this is a little much. We're going to break it down. I'm a visual person, and so when I teach or train or present, I like pictures. It's probably the kid in me, but I do like pictures. I think it explains it a little bit better. So congestive heart failure, you've heard these terms before as far as systolic and diastolic, the working part of the cardiac cycle and the resting part of the cardiac cycle. So basically, and simply put, congestive heart failure, the bottom chambers are called ventricles. Those are the big workhorse parts of the heart. Those are the ventricles. So the left side of the bottom of the heart doesn't pump effectively as it should. And that's according to Mayo Clinic. That is the simple definition of congestive heart failure. Now, we have to break it down because there's two kinds of congestive heart failure. Diastolic is basically the chamber gets really thick and stiff, so it can't fill. So the blood, it is filling, when we say can't fill, it's not filling with oxygenated blood because it's stiff and it's thick, okay? The next one is ineffective pumping of the heart, and that is systolic heart failure. And that's because the blood pressure has been so high for so long that it is stretched and stretched and stretched, so it's not pumping effectively. Now, both kinds of congestive heart failure, the end result are the same. The organs suffer because it's not getting the blood, oxygenated blood that it should. The first kind, diastolic heart failure, it's not getting blood to the organs because it don't have the blood, right? With systolic, it doesn't get blood to the organs because it has the blood in there, but it's so ineffective, it's not pumping the blood to the organs. So it's almost like, I don't know, for those of you that probably have had science classes and you heard the Starling's law. So this is where systolic goes with that. It's where if you see where we used to blow up balloons and then you re-blow it up, or and they get stretched, they stretch, you got all that pressure, and then they're just floppy balloons. Now, if you also have a rubber band, and the rubber band starts out small, okay, it's got a lot of elasticity in it, and you pop that rubber band and it's tight like that, it's effective pump, if you will, and you pop it, it'll go across the room, right? But if you stretch that rubber band and stretch it and stretch it and stretch it beyond its capacity and then try and pop it, it's not going anywhere. It's going to drop right by your foot. That's systolic congestive heart failure, where the blood pressure being high for so long has stretched and stretched and stretched and stretched and stretched so that now it has no elasticity and it can't even pump out the amount of blood it needs to, so your organs suffer. Okay? So that is congestive heart failure. Some of the signs of that, when it doesn't pump out the way it needs to, it actually then backs up, and now you have shortness of breath. You have what we call distended neck veins, because the blood should be going out and instead it's backing up. You'll have your veins in your neck will be extended, you're distended. You'll have congestive lungs and you can't breathe. It's where the fluid and the air fights and the fluid takes over. And so now you're short of breath. These are the people that are most of the time on oxygen at home. You can even have stomach pains because the fluid will back up in your stomach, and you'll have bloating. You think that it's something else and it's the fluid backing up, can't get where it needs to go to the right compartments. And then you'll have fluid around your ankles and your legs. What we like to tell patients, not like what we do tell patients, the standing goal is not to gain, and it has nothing to do with fat or muscle. When we have patients with this diagnosis, we have them weigh themselves at home. Again, scales are very cheap, and if you have a prescription, most insurances will pay for it. If you actually gain more than 3 pounds in a week, it's water. It is not fat. It is not muscle. If you're gaining more than 3 pounds in a week, you have water weight, and that is a reason to call your doctor and say, hey, I want to be checked. And there's lab work that they can check for congestive heart failure. There's an echocardiogram that they will do. I'm not going to get, that is a lesson all in of itself, but if you want to write down the terms so you can look really smart with your doctor, they'll check your ejection fraction, and we say your EF percentage. And this isn't on a 100% scale. So we want, if you have an EF that is under 50%, that means your ejection fraction of your left ventricle, that workhorse of the heart, is not pumping effectively to your organs. So they check that by doing an echocardiogram, doing chest x-rays, doing lab work, getting what they call a BNP. It's a protein that is released when there is extra fluid in the body. So not to get too scientific with you, but I do want to give you some valuable tools that you can write down. And I think everybody, I know I do. I am a nurse and should have it in my head, but sometimes I'm tired when I go to the doctor. I always take a notebook and I have questions and things, and I'm on my chart and I'm looking at things. And so that is congestive heart failure, ways to look out, things to look out for, things to ask your doctor for, and things to how to prevent it. One of the ways to prevent this is restricting your sodium, and we'll talk more about that when we talk about diet, but wherever salt goes, water follows it, okay? And so that's the combination and connection with salt and congestive heart failure. Next slide. So let's talk a little bit about our country and how the United States rank. This is the slide that when I said I learned some things that just really struck me with some alarming data, because in our country, and this is off of the website of CDC. So according to CDC, in our country, heart disease, first off, I'll say that when I got this information, there was a little addendum to it to say that some of the data is skewed because of all of the deaths that occurred in 2021 as a result of COVID-19 and the complications of COVID-19. So that made it even worse, because even with the data being skewed, meaning that there were a lot of deaths that were unprecedented in 2021, heart disease still came out on top as the leading cause of death in the US. So when our president asked, I did this presentation, a different variation of it a couple of years ago. When they asked me to do it, I thought, well, you know, things don't change much in the heart. I just did this. This is what I'm, you know, this self-talk that I do a lot. I'm like, I don't know if I'm going to have enough new information. And this slide alone did it for me, because we had the pandemic, we had all those deaths with the pandemic, and heart disease still in our country is the number one. That's a problem. I don't know about anybody else, but that's alarming to me, very alarming. According to this article, we have one death every 33 seconds. So what does that mean when you put it in perspective? I'm a numbers person. I thought, well, if we indeed are on this call for 2 hours, then in the time that we're together, one death every 33 seconds that is related to heart disease, we will have had 109 deaths by time we finish that is related to heart disease. That is a problem. That's a huge problem. And we had 700,000 deaths in 2021. So that's 1 in every 5 that was related to heart disease. Now, money doesn't mean, when you talk about life, money really, but for completeness, I have to give all of the information. In 2018 alone, we spent $300 billion in our country for heart disease. And we spent around the same amount in 2019. So I just want to point that out. Hopefully it startles you as much as it startled me. And if there are some things that you can change in your life or the lives of your family as it relates to heart disease and being on top of things, hopefully this slide gives you the motivation to do so. Then I brought it closer to home, and I talked to a cardiologist that I know personally, and I read, because I had read his little article that he had in the Healthy Living newspaper here. And he says that the percentage of smoking is higher, and I quote, I'm reading right from his newspaper, the percentage of smokers here is higher than in other parts of the country. And when he say here, he's talking about Northwest Ohio. So when we talk about risk factors, you'll hear me say that smoking, you'll see that smoking is at the top of that list. So Dr. Yaji believes that if we can get smoking under control, that we will lower these numbers. And that is my hope, prayer, that we do just that, because when we talk about risk factors, you'll see there's 2 different kinds, and smoking is at the top of the list. And I don't know about anybody else, but obviously we live in Northwest Ohio, and I want to be on top of the list for something else and not for smoking. But in the country, we lead we're at the top of the list for smokers. So if, you know, and there's, you'll have resource in this presentation. If you have family members or anybody that's smoking, you can, they're shortening their life span. I mean, simply put, they're shortening their life by nicotine, because nicotine starves the oxygen from the blood. So it's not like in congestive heart failure where the blood's not getting where it needs to go. It's getting there, but it's not oxygenated, so it may as well not get there because it's not doing any good. So that's my spiel. If you can't tell, I was on a little bit of a soapbox, so I'm sorry. Next slide. So let's talk about those risk factors. As we see, some are modifiable and some are non-modifiable. So you'll see the modifiable on the left side of your screen. You see that is a longer list. What does modifiable mean? Modifiable, simply put, means you control it. These are things that you can change. So smoking, as we just talked about at great lengths, is at the top of that list. Sedentary lifestyle. The body was made to move, okay? So we have to move. You can't go from not moving at all to running 10 miles. Let's be realistic. We'll give you some tools later in this presentation on safe movement and how to have monitored movement, but just move. Let's just get up and move. We have to, we're on the computers. We have jobs that a lot of times now we're working from home. So we're sitting at a computer. Everything is sitting down. We have to move. I'm not going to give you a prescription on how much to move. I'm just going to recommend, strongly recommend that starting tomorrow, move. Get up a little extra early and move. Diet and obesity are on the modifiable risk factor list. We, as we know in this country, I'm overweight. Okay, I'll say that for me, I'm overweight. So we have to get that under control safely. Obesity leads to diabetes, and diabetes is on this modifiable risk. And you probably wonder, why is it on the modifiable? That's a disease. Yes, you can. You can control diabetes. I think about my aunt, bless her, in her grave. My Aunt Helen told the doctor, I'm not going to be on no pills. I'm not going to be on no insulin. And you could go to Bob Evans, which is where I saw her. I go in the bathroom, and before I see the person, I hear 1, 2, 3, 4. And I'm like, what is going on in this bathroom? And it was my Aunt Helen. She was in there because she believed that she gonna get her steps in. She wanted to make sure she had set times that she was gonna exercise. She didn't care where she was. She was gonna do her exercise. And she got off the pill. She never had to do insulin, and her numbers lowered, and she was no longer a diabetic. So it is modifiable. High cholesterol is modifiable. Those things that are not modifiable, that list is a little shorter. So take control. What this slide is saying is that this long list of modifiable can outdo the non-modifiables and put you in a better state as far as heart health. We can't do anything about our race. We can't do anything about our sex and our age. Well, the sex, that's a whole nother story, but the way you were born, you can't do anything about that. And the family history, which predisposes you to heart disease, you can't do anything about who your family is, okay? Literature and studies show in American Heart Association that according to American Heart Association, 80% of the heart deaths are over 65, which means that as we get older, it becomes even more important to take care of your heart, because those are the people that are dying from heart disease. 80% of the heart deaths that was in 2018 were over 65. So that we're getting there. So take care of your hearts, get moving, stop smoking. Make sure, you know, when we get to the cholesterol and all those things, we'll talk more in depth about that and how you can take control of your risk factors. So how do we decrease some of these risk factors? Next slide. As we say, it warrants repeating. We're made to move, get moving. Read the nutrition labels. We'll talk about that. Choose your food wisely, as well as portion controls. Adequate sleep, because sleep regenerates the blood cells and it allows the heart to work and be more effective. So we need to, and as I was doing this, my pastor often say, when he's prepared a sermon, he takes it to himself first. So I'm not saying all this like I've arrived. Trust me. That's why at the beginning, when I welcomed you, I said, I am excited that we have prioritized our health and taken time out to listen to this presentation. Because as I listened to myself practicing this presentation, I said, okay, you have to practice what you preach. So adequate sleep, reducing stress. Stress on the body is overlooked by many. The stress on the body releases acid in your blood cells, and diseases love acidic environment, especially cancer. Cancer cells grow, they thrive on acid. So when you decrease the stress and you increase the blood supply and oxygen to your blood vessels by moving and exercising, you're making your blood environment more alkaline, which is healthy environment, instead of acidic, which is cancer and disease prone environments. We already talked about smoke cessation, controlling your blood pressure, and your blood glucose monitoring. So if you have, they love to do this term pre-diabetes. I'm just going to give you specific science data. It's almost like pre-pregnant. I mean, either you're pregnant or you're not. So that's kind of how I feel about pre-diabetes. However, when they have a lab called hemoglobin A1C, and that is a 3-month average of what your blood pressures have been running. If that average is over 6%, then you are diabetic. And so this pre-diabetes is like when it's 5.5 to 5.9, they say it's pre-diabetes. And I understand the thought process behind that is kind of with how they lower the blood pressure standards. What they're saying is if people are in the 5.5 range and they don't do any lifestyle changes, then they're probably going to become a diabetic. So I get that. But to be tagged with it, I think that when your doctors tell you that, then you need to do some behavior modifications, which we talked about in the previous slide. And then they will more than likely, what is recommended, that they check that every 6 to 9 months. So that's another term that you can write down, hemoglobin A1C, okay? That is a 3-month average of your blood pressure. Your blood sugar, I'm sorry. So when they give you that number, they will also tell you what your blood sugar average has been. So they'll give you a number and tell you your A1C was this, which means that your blood sugar average over the past 3 months has been this. And danger zones, I've seen people with A1Cs of 12 and 13, which means their blood sugar average has been running over 400, which definitely puts you at risk for heart disease. So I want to entertain any questions, Natalie, at this time.
Yes, we have, the chat has been very lively, so there are several questions and comments.
Okay, that's fine. That's
I will
great,
start-
actually.
Absolutely, yes, great. I will start with the questions first. Tracy Huff asked, when you were referring to the damage that high blood pressure causes to your body, can the damage caused by HBP be reversed with medication and lifestyle changes?
Certain things can, certain parts of blood vessels and vessels regenerate if they are ischemic, means low oxygen, but if they're necrotic, that's dead cell, and those dead cells will not regenerate. So that's why it's important to, stay on top of things. So say, for instance, if you have kidney, it's called, if you have insufficiency versus failure. So if your kidney numbers are in a certain range, and it's in that range because they have not been getting blood supply because of high blood pressure, and you lower your HBP, now it was insufficient, and so lowering it will improve it. And yes, those numbers can be reversed. But if you have necrosis to the vessels that lead to your kidney because they've been starved of oxygen and blood for so long, then that area will not regenerate. So I don't want to make anybody afraid. This is why we're doing this presentation. It's just important to, if you've seen, I used to, urinate several times a day and I'm not, or my urine is really dark. And so it's all of those things, and it's not a snapshot. The body and health is never a snapshot. That's why we go to the doctor on a routine basis. That's why if they recommend that you weigh yourself daily, or you take your blood pressure or blood sugar once a day, you can get a handle on things ahead of time. So yes, the long and the short is it all depends on the degree of damage. And that is for your physician then to work out a plan with you, do more testing, diagnostic testing. But yes, getting that under control, you definitely can turn things around.
Excellent. Thank you so much. The second question is from Dr. Brenda Halsey. She asked, kind of on the same vein, can the systolic stretching that you referenced, can that be reversed?
Yes, and some of these I'm going to give you what I've seen and what I know, but I don't want to be quoted as a scientific definite, because that will be for your doctor, because it's called cardiomyopathy is what actually happens. You probably heard of that term. When the stretching happens, the stretching of the heart, it gets floppy, if you will, and that's called cardiomyopathy. And yes, cardiomyopathy can definitely improve, but that's not a blanket statement, because how long has it gone? How floppy is the heart? What degree of cardiomyopathy do you have? And so there's medications for that. There is lifestyle changes for that. And that would be a talk and a discussion with your provider, so that because I've seen echocardiograms, there's things that can help cardiomyopathy, defibrillator, pacemakers that help with that congestive heart failure. So there's a lot of different treatments, but that's a discussion that you and your provider should have, because I have definitely seen people's EF go from 15%, which is basically almost incompatible with life, that when they have a defibrillator, ICD put in, behavior modification, diet changes, medications, in 6 to 9 months, their EF or ejection fraction actually have doubled. And then in another year or so, they'll check it and it's gone up to 45%. Now I have never seen them go up to 50 and be normal, but when you're 40 to 45 with medication and doctors, treatments and care monitoring, you can pretty much live a pretty productive life with that. So I've definitely seen it, but again, it's not a blanket statement. That is a discussion that you would have with your provider.
Great, thank you. The next question is mine. You were referencing the about smoking and how it's terrible for you. I'm wondering, does that include vaping as well?
Absolutely, absolutely. Any form of now I know they have this nicotine. I've done some research. I don't know, but I've seen people vaping and then you don't smell it. And I guess there's some, well, not guess, there is some nicotine free, and they just do it because they have this oral addiction, so to speak. They have to have something in their mouth, and they do it for the mechanics of it instead of what they're ingesting. However, the body mechanics of vaping has been linked to pulmonary blebs, is little outpouchings on the lungs where people then they blow, and that because of that it's happening over and over and over again, and it is weakening those vessels. And so we've had young kids, unfortunately, I've had several young patients that as a result of vaping, they get blebs that pop, and so they have what we call a pneumothorax. And what that is the air that should be in the lung is on the outside of the lung. And so it's pressing up against the lung and it's not allowing the lung to expand. And it's a life-threatening event. Those people, if we don't put a chest tube in them immediately, they die. So vaping is very dangerous, very, 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 very dangerous. And I can't say it enough. And I see people vaping as if it's nothing. And yes, especially the nicotine ones, you've got the potential for the pneumothorax, of which I just described, as well as the nicotine. So that's a double whammy. So in that instance, vaping is even more dangerous than smoking.
Wow, thank you very much.
Mm-hmm.
Frankie Young asks, does secondhand smoke exposure have the same effects on the body? For example, if a parent was a chain smoker.
Absolutely. It's again, most people consider it just as dangerous, if not more, because most cigarettes are filtered and you're in the secondhand smoke and it's not filtered, even though you're not getting the amount of it. But for years and years of secondhand smoke, there has been incidents linked to cancer and death, just as if you were smoking a cigarette.
Great, thank you. I will share some of our great comments. So people are commenting that your illustrations are really wonderful. I really appreciated the balloon analogy myself. And just when you were talking about moving your body, getting your steps in is so important. Tracy stated, our work environment promotes not moving, sitting, and meetings after the meeting, which is not good. We need to change this. And she said she needs to change this in her own life. And also, the knowledge is power. It's very helpful, even though it is a little scary. And we thank you, Sister Arlene.
Oh, thank you for your comments. And I don't want to be gloom and doom. I just want you to have the information, take what you can relate to and do something about it. That's it. I'm not giving anybody a death sentence. But I just want you to have the information. And if there's something that you can relate to, take that, do something about it. And then shoot us, get on New Perspectives website or anything, and just let us know, that you've changed this or you've done this, or because that's what we want, it's a call to action. So yes, this is information sharing, knowledge gaining, but we want to call to action as a result of it. And we want to change lives, and we want to, as Crystal said in her opening, keep us around a little longer. So thank you for that. Okay, so we talked about those beat up arteries that end up shutting down and getting hard. And so that's what atherosclerosis is. So it's a buildup of fat and cholesterol and other substance in the artery wall. And it shows you the picture there that there's plaque build up. And so then the plaque takes the space of where blood should be flowing. And so that artery becomes narrowed. And this particular one is in the brain. And so the arteries that lead to the brain are narrowed. And this is what causes ischemic strokes, because the brain doesn't get that oxygenated blood and is narrowed. And so then it suffers. And then obviously there's different types of stroke, and I'm not going to go into all of that, the different parts of the brain that it impacts, which means that's where your deficit will be. But at any rate, high level talk on this is the arteries are hardened because they're non-compliant, because they've been beat up by high blood pressure. And so then plaque breaks off. When plaque breaks off, then it gets really narrowed, and that's where ischemic or low oxygen strokes occur. So the backup or the buildup of cholesterol in the wall, like I said, it causes that. And then clots don't have to be blood. They can be clots or break off of plaque as well. So the heart is like a electricity as well as plumbing. And so in this instance, there is nothing wrong with the electrical component of the heart, but rather the plumbing part of the heart. Things aren't flowing through. Next slide. So what should we watch for when we talk about heart disease and having a heart attack and heart events? So extreme fatigue, chest pain, shortness of breath, as we talked about. If you have low oxygen going to your lungs, then it's going to result in shortness of breath. So that is one thing to watch out for. Dizziness can happen because of that whole atherosclerosis, the previous slide that showed the low flow going to the brain. So if there's not oxygen to the brain, you can get dizzy, and then that can cause fainting. You can have cold sweats, nausea, vomiting, jaw, tooth pain, and these are some of the atypical or not usual things that happen for our special population. And what I mean by special population is women. A lot of women have different atypical, if you will, symptoms. So pay attention to your body. And I don't want anybody just becoming a hypochondriac, but just know that if you go to the dentist, your teeth have been fine, you've not had any cavities, whatever, and all of a sudden you have this nagging tooth pain that is consistent and constant, and then along with it, you're having some shortness of breath. Those could be signs for women, those could be signs of a heart attack. So consult your physician. I'm not saying you are having a heart attack, but that's in literature, and down through the years, I'm sure you've heard people say, well, for women, it's a little bit different. And that is absolutely true. You may not have that somebody sitting on the chest. Men are the ones that usually have that crushing, oh my God, somebody's sitting on my chest. Men have those symptoms. Women have more vague type symptoms, the jaw pain, the tooth pain. My arm is just a little numb and achy, and I'm having some nausea, and I haven't really even eaten anything. There's a certain part of the heart called the right coronary artery. It kind of rests right on the sphincter of the stomach. And so when that part of the heart is impacted, people have vomiting, and they haven't had a fever. It's not flu-like symptoms. All of a sudden, they're just like nausea and vomiting for no reason. Most of the time, they're having a right-sided heart attack. So just some of the warning signs to look for. Again, do not leave this presentation down, depressed, and a hypochondriac, because then I will feel defeated. That is not the purpose. You should get this information, take what you can, and what you can actually relate to. And the key thing that I would like people to do is, if you can relate to something, have a discussion with your physician. That's what should happen. That should be the outcome and the call to action. Have a talk with your physician, and then your physician can then say, oh, we should look into that, or, oh no, Natalie, I don't think that's you, and this is why. And then they can just allay the fears away. Okay. As far as diabetics, they have a thing called neuropathy, many of them. So they can have heart attack without having the actual pain, because their nerve endings have been damaged from the diabetes. And so those are the special population. Diabetics don't always have the heart pain, and they're having a heart attack. And females don't have the typical symptoms. So keeping a diary, taking that to your physician is what I recommend as far as watching what to watch out for. Next slide. So high blood pressure and stroke. A direct correlation with this, and these are the 3 reasons why. High blood pressure can increase the heart irregularity, and you probably heard the term atrial fibrillation. Is kind of when the heart is just ineffectively quivering. That whole cardiac cycle that we talked about earlier isn't a normal cardiac cycle. It's just kind of quivering. So then when it quivers, it can break off little clots, and the blood thickens when you're in atrial fib, because it's not really pumping through effectively. And when blood kind of is stagnant, it gets thick. And if it gets thick, it can throw clots. And so that's the next part of that, where it says plaque and blood clots form in the carotid arteries. That's because the high blood pressure can lead to the irregular heart rhythm. The irregular heart rhythm leads to a slower flow of blood. And if blood is stagnant, then it tends to clot. If it clots, then it can cause an ischemic stroke. So you'll see the last diagram there says ischemic versus hemorrhagic. We talked about ischemic, which is low oxygen to the brain. And then we talk now about hemorrhagic stroke. What happens with hemorrhagic strokes? The blood pressure can be so high and untreated for so long that the vessels have been beat up, and then they get a little area of thinning. And when they thin, it's an aneurysm in the brain and the vessels that lead to the brain. And when those pop, then there's blood in the brain, outside of the brain, pressing on the brain. And those are usually fatal at the time that they happen. But there has been some miracle states where we've had patients that have had hemorrhagic strokes. And with all the new interventions of coilings and different things that they can do to put right in that aneurysm to reroute blood away from the aneurysm, we've had some fairly good outcomes with that. So those are the two different kinds of strokes. The ischemic is the low oxygen stroke, and then the hemorrhagic is a bleeding stroke. And high blood pressure can be the cause of both. Any questions before we go to continuing with stroke?
Yes, we do. We have one question in the chat and one question in my head, which I'm going to ask. I will start with the question in the chat first.
Okay.
It is from Zuri Carter. And Zuri asks, can the narrowing of the blood vessels be reversed?
Yes, with intervention, what we call intervention. So if there are narrowing in your arteries, it all depends on where it is, what the degree of narrowing is, and it can be reversed or corrected by stents. That's what we do. That's what stents, when you hear people say, I had 3 stents put in my heart, that's what they're saying. They put what we call DESs, or drug-eluting stents. So it's a stent that has been soaked in a drug. The drug is a blood thinner and an antiplatelet, because platelets are the sticky part of blood. And so platelets lend to clots because it makes the blood stick together. And then when it sticks together, it forms a clot. So they can put DES stents in, or they can do balloon angioplasty, where they go in where that blockage is. They dilate, relax, and they dilate in hopes that years ago we used to dilate, and then once we got it open to a certain degree, I'm not the doctor, but once they got it to a certain degree, then they would just pull the device out and send them to recovery. But what they found is that even with the antiplatelet medications called Plavix and things of that nature, and the blood thinners, that people were restenosing. So that's when they will angioplast it to open it up. But then once they get it open, they will put a DES in, a drug-eluting stent, to keep it open.
Thank you so much. And the question that I have in my head that I did not type in the chat is, okay, so I personally take a low dose high blood pressure pill. It's a combination of blood pressure and hydrochlorothiazide, which is a water pill, as is commonly known. So what does blood pressure medicine do? Is it just keeping my systolic and diastolic lower? Is it reversing damage? I've always been curious to know.
Yeah, it is the chemical components of it is doing just that. Most blood pressure pills are a little bit of a vasodilator. So they're dilating that artery so that blood can get through at a normal rate and not be tightened. And so it relaxes those arteries and those vessels so that your blood pressure, because it's the blood pressure being high is the beating on that wall. So it decreases that beating on the vessel wall, hence lowering the blood pressure, hence lowering the damage to that wall, and all of these things that we've talked about as a result of that damage to the wall. So as I said before, lowering it at a safe rate, which is a rate that you and your doctor will come up with that is safe for you. And I like the fact that you said it's a low dose, because we start low. I always tell when I teach new nurses, I say, look, you can always give more, but once you've given it, you can't take it back. So if you don't know how a patient's going to respond to something, we always give test dose or lower doses and trend them for the desired effect. And if we get the desired effect, then life is good. If we don't, then we add a little something else and we keep doing. And that's what doctors will do. That's best practice. You shouldn't start people off with 2 agents, you know, a hydrochlorothiazide and a beta blocker and a this and a that calcium. Like, you have to start low because you will shock the system if you don't, and it could be dangerous. So hopefully that answers your question.
Thank you so much. Yes, that was perfect. So the comments that I would like to share, I'm just double checking to make sure I didn't miss any questions. Yes. Christy, Sister Christy said, this is all so incredibly informative. I've heard many of the terms, but not necessarily clearly understood, especially the heart being described as electrical and plumbing. So thank you very much for that.
You're welcome.
Sorry about the chimes. Crystal shared that she did not know, nor did I, that stents had medicine in them. That was news to me. To
Yes.
us, I should say, sorry.
Yes.
That's news to us.
So just to correct, they're drug eluting, which means that they're coated with a blood thinner and an
Okay.
antiplatelet. So it's not actually medicine in the stent, it's what the stent is coated with, because the stent itself is what is coming in contact with the vessel. Okay. And so the outside of that stent is like bathed, if you will, in this antiplatelet and anti-clotting drug.
Excellent. Thank you.
Sure.
And we just had another one come in from Terry Cook. She states, my father and mother suffer from heart disease. Both had stents. I was just diagnosed with high cholesterol. This information is really enlightening me, and I will certainly be making more serious changes in my lifestyle.
Awesome. Awesome.
Excellent. And Denise Ford Saxon shared, blood pressure medication is often prescribed as a migraine preventative. Her question is, although the patient does not have high blood pressure, is it safe to just stop the medication if migraines are not as severe as they once had been?
No, emphatic no. It's never safe to stop your medications without speaking with your doctor, because there are a lot of medications that are approved by the FDA, off-label use is what we call it. So while that med, when that manufacturer made it, it's in the medications she's speaking of is beta blockers. We often use beta blockers for headache because, as I said, blood pressure medications are vasodilators. So they dilate the vessels so that they relax. When they're dilated, they relax, and that causes the pressure to drop because now it's not tight and beating, okay, which is what migraines sometimes come from. So even though it is prescribed for the dilation and the off-label use that is going to help your migraines, it is also the drug component, the chemical components of that drug doesn't change. And no medications, any medication should not be stopped by the patient without consulting with their physician, especially heart medications.
Excellent. We are caught up in the chat. Thank you so much.
No, thank you. Okay, so next slide. So this, we talked about signs of stroke, and you'll see that the word FAST, or the acronym at the bottom, FAST, is in red, and then the BE is in black. And the reason for that, whenever we try and teach the community, we used to say, if you think you're having a stroke, do this test, and it's FAST. Check the person's face. Is their smile even, or is it crooked? Then they probably are having a stroke or a TIA or Bell's palsy. But then you go on with the arms. You have them hold their arms out straight. If one starts to drift, then more than likely there's a stroke. It's on the opposite. If my left arm drifts, then my stroke is on my right side, and vice versa. You have them say their name. If they can't say their name and they're slurring their speech, they're probably having a stroke. If all of those things check out, then it's time to call 911, because time is tissue. You lose tissue, brain. So someone asked earlier about things being reversed. If it becomes ischemic, it can be reversed. And there's medications that you have to give within a very short amount of time, which is a 3-hour window. So you need to call right away. Don't be playing around saying, well, I'm gonna lay down and see if I feel better. And if I don't feel better, then I'm gonna call you. If you're not in that window, I have, and I get really emotional in a good way when I seen a patient who came in who could not talk at all, came in through the ER. They gave the TNK, which is a clot buster. They broke the clot up. We had to check the patient, of course, every 15 minutes. We do neuro checks. And by the end of my shift, this lady was sitting up on the side of her bed talking normal. So time is of the essence. I can't say that enough and strong enough. If you have any of these fast symptoms, you definitely want to call 911. Just in the past 5 years, I believe it was, they added the B to it. That's why B is Black, because they found that sometimes the fast part is okay, but people's balance was off. They walked in and then they just fall like, whoa, what was that? I didn't bump into anything and I'm falling. Their balance is off. Or where you feel like something is constantly in your eyes and your vision, everything look blurred and you got your glasses on, you just got a new prescription, but you can't really see well. So there's a part of the brain that impacts the balance in your eyes, and we were missing those as a medical community. And thanks to American Heart, they did research over the years and they found out that those things were happening and the fast was okay. So now we tell people be fast. So check, in addition to the face, arm, speech, and saying that time is tissue, check the balance. If there's issues with balance, or if there is issues with your vision, you could be having a stroke. If any of those things are positive, then you need to call 911. You don't call your family. You don't get in the car and drive yourself. You call 911, because time is of the essence, and these things can be completely reversed if caught in time and treated. Okay, next slide. So we're nearing the end of the presentation. I just wanted to touch a little bit on label reading, because this will help all of those things that we talked about, those modifiable risk factors. And a lot of people don't understand. Well, first off, a lot of people don't read labels, which is a huge mistake. But when you look at a label, that's a sample of an example of a label that we all know. That's no rocket science information there. But in the top 3 ingredients, when you look at the ingredients of a food item, the top 3 things is pretty much the largest percentage of that food item. So you'll look for some of those hidden sugars. So if your top thing says refined grains and things of that nature, assume that that is an unhealthy food item, okay? You also want to look at the serving size. So for congestive heart failure patients, we recommend that they keep their sodium per serving under 300 milligrams per serving. A lot of times people forget the serving size, because you'll get it, you'll see this, there's 8 servings. So anything you see in the columns, you have to multiply it by 8. So with sodium, you multiply that by 8. You have had more than the sodium that you should have today and half of tomorrow. Okay, so you have to read the serving size, and you multiply what's in the serving by the serving size, and that gives you your total. Look at your calories, of course, and what foods to limit is all of those things. Like I said, the heavy sugars and syrups and cane sugars. Those are some of the hidden things, the hidden sugars. They won't come out and just say sugar, but if it's saying cane sugars and syrups, the heavy syrups, all of those things are unhealthy. So American Heart actually recommends for women that per day, the amount of calories that we have, only 100 of them should come from sugars. That should be our daily allowance. And that's the understanding that DV percentage. Your daily allowance of sugar content from your calories for women is 100. For men, they get a little more. their daily allowance of sugar, calories from sugar is 150. So just knowing a little bit about that, that is just some basic information. You can delve deeper by looking at through that website. That link. And there's a lot of information on label reading, but I just wanted to point out the sodium content, mainly the sugar content and the serving size. And the top 3 ingredients in that product is what that product is mostly made of. If you see one of the top thing as refined grains, that's another way of saying sugar. You can pretty much assume that that item is unhealthy. So having said that, next slide, we'll talk a little bit about this cholesterol puzzle. I will admit that when I was in nursing school, I was so confused. I used to have to make acronyms, okay, because the low density, in my head, I was like, low, okay, then that's good. You know, the L is good. And so this is what literature has out there, and it even helped me today still. I don't get it mixed up, but it helped me be able to teach it because in my current job in cardiac rehab, I teach a lot of this. And so it helps me when I'm teaching to look at it this way, to know that cholesterol, the total cholesterol, if it's high, it contributes to coronary artery disease. So we want the total cholesterol to be under 200, okay? And then low density lipoprotein is low, L equals lousy. So that's the low density. And low density, the reason is lousy is because it encourages cholesterol to stick around. Okay, so it's low density. Your HDL, which is your high density lipoprotein, which is happy, high for happy, that one helps carry cholesterol away from the vessels. So that's why it is the one that we want the HDL to be above 40. And I'm going to back up. I didn't give you where we want the LDL. That's the only one that's a range. And we want that to be between 70 and 100. So that's the only cholesterol that has a range. Because even though it's bad, we need some of it. And so we don't want it 0, but we want it between 70 and 100. And then your triglycerides, most common fat in the body, it's a major source of energy. So we don't want this at 0 either, or we won't have any energy. But with your triglycerides, a good number is less than 150. So this is where we're getting our energy from. But if it's over 150, then it lends to coronary artery disease or heart disease. So one way to help decrease your cholesterol levels is fiber. Now, fiber is a funny thing. As you're adding fiber, you have to add it gradually, and then you have to increase the amount of water, because fiber helps the cholesterol, it helps the HDL carry that cholesterol away, but it can cause some GI upset and things. So you want to make sure that you increase and introduce fiber to your diet at a lower, rate. Dietitians, this is very low level information, meaning, or high level, I should say, information where I'm giving you the basics and some titles and topics to talk to your physician. They have dietitians that can actually give you information on these. And so I'm giving you some of the high level, like what the numbers should be, how to help decrease it by reading those labels, by increasing fiber. And as you increase fiber, you should also increase your water. Any questions before we go to our final few slides here?
We have a couple of comments that I would like to share. Terry Cook stated when she received her diagnosis 2 weeks ago, all she does now is read labels, and it has, she said, surely helped her on her grocery bill.
Good.
I agree. You will be shocked at some of the things that you find. Like you said, the labeling is very confusing. It's low sodium, low this, and I've noticed too, when they lower something, they usually increase something else. So pay attention.
Absolutely. Absolutely.
And we have also been dropping some of the tidbits and some of the numbers that you're sharing into the chat. We've also added a link, the fast link into the website that was mentioned. So please check those things out. And Crystal shared, if your last cholesterol test was under all the right numbers, is it
Mhm.
okay to stop taking your cholesterol medicine or cut back? I know she said, I know we should talk to the doctor, um,
Mhm.
but what if you can't get in to speak with your doctor?
I still recommend, I will never, ever, ever go on record telling anybody to stop their medication without consulting with the physician. So, um, however, it has always been my goal. I take several meds. It's always been my goal to decrease the amount of medications I take. So I take those goal. I'm a very goal oriented person in all of my life. And so when in my little notebook, I take that to the doctor and I'm constantly asking them, okay, can we try this? And I know they get tired of me, and some of them they let me try. So that's what I recommend: writing those things down, writing your wish list down in a notebook, and having that dialogue with the doctor. And you might have to have blood drawn more frequently, because if they do an intervention, best practice is saying that you need to check that intervention more frequently to see if it was successful or not, and to see if you need to change. So I think it's a great goal, Crystal, to want to lower the amount of medications that you take. I just think that goal needs to be communicated with your physician, and the two of you come up with what is appropriate for you.
Excellent. Thank you.
Mhm.
And the last comment that I would like to share from Denise Ford Saxon. This is very educating and informative and has great life-saving takeaways. I wanted to be sure that I let you know that we are very appreciative. And Crystal,
Thank you.
thank you.
Oh, you're welcome. You're welcome. Okay, so the next slide. I know we're all probably hungry, so I wanted to end my portion with sharing some heart healthy recipes. And each one of those, like the easy chicken tenders with lemon and garlic, is on the top, and so on and so forth. There's a lot of recipes, but these looked really good. So the website to this is in our reference, on our reference page. I wanted to also say that these things will help lower your cholesterol, because they're not using the oils and the fatty things. Omega-3, that's is found in salmon and tuna and flaxseed and all of those type of things. So that's one way to eat healthy, but not give up your taste and your flavor. Another way to add flavor without adding salt is bay leaves, allspice, almond extract, basil, chives. All of those, just look up, even if you Google or talk to your nutrition about ways of adding flavor. I had 5 pages and I said, okay, Arlene, the presentation is 2 hours. So you can't put all that in there, but I just wanted to, some of those things that I know we probably use. I know when I cook my chili, bay leaves, and I love bay leaves in my chili. It adds so much flavor without all of those packages of chili stuff that's full of sodium. So just think about that and do some research on that, and just do a little paradigm shifting in your brain of how to make your food, the presentation be pretty, the flavor still be there, not foregoing the flavor by substituting those spices and things for the salt. So I just wanted to end my presentation part of this on healthy eating and a good lunch ideas. So I do thank you. Last slide. Thank you so much for your participation today. We have a couple of things that Crystal's gonna put. We talked about resources. I will introduce it on the video. It's just a short clip, but I do want to just let you know that one of my jobs is cardiac rehab. So even with those modifiable things that we do, still, unfortunately, some people end up with cardiac disease. And if so, there are resources. One of the resources is where I currently work for Flower Hospital, ProMedica Flower Hospital, in cardiac rehab. And so we have a couple testimonials of that as far as resource. If anyone in your family finds themselves in this predicament, this is a great resource. And the clip will tell you how a person gets started and what it actually is. And then it'll end with a testimony. So thank you again so much for your time. And I hope that you've learned some things. And again, don't be a hypochondriac. Don't be, gloom and doom. We're all going to be okay. We're learning, and we're going to take this information for everything that we can take from it, take the nuggets, take them back to your doctors, and then do something about it. And most of all, get moving. And if you are a smoker, stop smoking. Those are the top 2 takeaways that I would like to leave you with out of all. I know I've said a lot of things. So get moving, stop smoking. And that's it. Thank you. First off, thank you so much for your willingness to share about cardiac rehab. My name is Arlene Ford Bond. I am part of the National Association of Business Women. I'm also part of ProMedica, and I'm also part of cardiac rehab. So I just wanted to, during this presentation, I wanted to share ways to decrease risk factors associated with heart disease. I also wanted to share 2 different kinds of risk factors, and we know that some are modifiable, meaning that we can change them, and some are non-modifiable, which means that we can't change them. So sometimes, unfortunately, with lifestyle changes, things that we modify, we still find ourselves in the instance where we have cardiac disease. So this may be as a result of race, age, family history, and those things that we can't change. So the first question that I have, I want you to introduce yourself and give us a little bit about how a person can get started in cardiac rehab. What's the first steps?
Hi, I'm Robbie. I'm one of the exercise therapists with ProMedica Flower Hospital Cardiac Rehab. And as far as getting started with cardiac rehab, one of the first things we're looking for is a qualifying diagnosis, be that a CABG, coronary artery bypass graft. Some people just refer to that as open heart or bypass surgery. A heart attack, having a stent placed, or being diagnosed with congestive heart failure. Those would all be qualifying diagnoses for cardiac rehab. Obviously, we don't want any of those to happen. We want to try to prevent those as much as possible. But in case they do, in most cases, the person is hospitalized. They're receiving treatment as well as education in the hospital about how to proceed after their discharge from the hospital. And then from there, their doctor puts in an order for cardiac rehab, where we are the ones to reach out, get that person scheduled and evaluated so that they can start the program sooner rather than later and start that road to recovery.
Great. That's awesome. Thank you so much, Robbie.
Thank you.
So the next question that I have, share with us a little bit about evidence-based practice. Robbie talked about the program. So how do we know that this actually works, and how evidence-based practice is associated with cardiac rehab as far as having positive outcomes?
Hello, my name is Asusa. Everybody refers to me as Seuss. Also an exercise therapist here with ProMedica Flower Cardiac Rehab. And with evidence-based practice, a lot of programs like UTMC, St. Luke's actually have physical numbers showing the benefits of cardiac rehab, with UTMC stating that it has a 30 to 35% chance of lessening your chance of going back to the hospital due to cardiac related issues. In St. Luke's, when they're open, stating that it increases your life expectancy by an extra 5 to 10 years from your cardiac event, whether that be open heart surgery, heart attack, stent placement, et cetera, et cetera. It's a supplement to, what you had, a supplement to your open heart surgery, a supplement to the stent, a supplement to medications they may put you on to control symptoms, with exercise being another sort of medication to help increase your quality of life.
Thank you so much, Seuss. Those are really stunning numbers, and it shows the benefit of cardiac rehab. So thank you so much for that. The next question that I have is, how does the program actually work? I know Robbie told us about how to get started, and then Seuss gave us, some evidence-based practice. But if I were to sign up, like, what actually happens? How does it work?
So my name's Jacob. I'm one of the other exercise therapists here at Flower Hospital. So cardiac rehab, when you come in for the program, it's a monitored exercise program in which we'll have you on a heart monitor while you exercise, keeping track of everything, keeping an eye on you, making sure everything's nice and safe. It's a program that typically lasts 2 to 3 months. about an hour or so each time where we do different exercises personalized to the patient. That way, nobody gets hurt, nobody gets anything wrong or worse with them. We mix in weight training, strength training, flexibility. So it's all kinds of different stuff. It's a gradual progression that a lot of people compare to physical therapy. So it's like you get your knee fixed, you go to physical therapy, get it better. You get your heart fixed, you go to cardiac rehab to get it better.
That was that made it plain for me, and I'm a nurse. And just hearing that like that makes it very plain. So thank you so much, Jacob. The last question that I have, actually, Sue's kind of hit on this, but just wanted to know, or it might have been Robbie, just wanted to know, a lot of people think of cardiac rehab, meaning that if you have a heart attack, but can you just reiterate some of those things that was previously shared? Is it only for heart attack patients? If not, again, just reiterate on what type of patients can even ask their physicians, because I know we talked about needing a referral and qualifying diagnosis. So if something's going on with me, how can I ask for something like cardiac rehab, even if I haven't had a heart attack?
Seuss again. So with cardiac rehab, it's based on event by event. So the event being a heart attack, whether it's a STEMI or an NSTEMI, CABG, like Robbie was saying earlier, open heart surgery, any open heart procedure, whether that's a bypass or valve procedures or valve repairs that may have gone through a catheter, whether through your arm or through your groin. A heart failure diagnosis is also considered an event that would consider you up for cardiac rehab or referral. So it's specifically based on those criteria that would get you the referral from your physician for cardiac rehab. And usually how it works is the physician will either put the referral in right after they do the procedure and then bring it up to them, following up with them outpatient after said procedure or said diagnosis. Hey, this is something you should look into as a supplement to these meds we put you on, as supplement to your surgery to help kind of aid in your recovery. Usually like that. So it'd be those specific diagnoses that will qualify you for cardiac rehab. That's how you would get set up with everything. Usually the physicians are good at bringing it up after, all these things have happened to patients.
Okay. Well, thank you so very much, each of you, for taking time out of your day to share with our community, as this is Heart Health Month. And we want to improve the health and well-being, which is our vision and mission here at ProMedica, to improve the health and well-being of our community. And we're hopeful that this presentation will do just that. So once again, thank you so much. First off, thank you so much for your will.
All new at 7, February is Heart Month, and one local woman is sharing her heart story and what saved her life. 13 Action News reporter Brenna Nye joins us live with her story, all new at 7. Brenna.
Christian Ruby Radford had triple coronary artery bypass surgery in October 2022. She told me that she was unsure of what the future would look like from that point on, but looking back, she wouldn't change a thing.
I have gone through what I call unfamiliar territory.
This is how Ruby Radford describes the last few years of her life. After a checkup with a new doctor led to finding a blockage to her heart, she was diagnosed with congestive heart failure, had open heart surgery, and wore a portable defibrillator 24/7.
Mine, I didn't have. I shut down. I call it a fog because I have lived long enough to know this was not in my area of specialty. So I went into what I call my faith mode. I'm going to have to trust going forward that those who are experts in this area will do what they can for me.
Her surgeon recommended she begin cardiac rehab to bring her heart health back to normal. At first, she wasn't fond of the thought of rehab.
Mentally, I wasn't having this. I wasn't processing this because everybody along the way, the pieces, were doing their best, and I was so grateful. But it was when I arrived in cardiac rehab, all those pieces came together.
Ruby spent 12 weeks in rehab. Isusa Agubor was Ruby's exercise therapist.
Well, the bike was always a problem with her. She was always complaining about it, the demon bike. But, first starting off, she was on the life vest. She was on it for a reason. So, she'd start off really tired and just really exhausted. But then as she kind of gradually went on, I don't even think she really noticed it.
Looking back, Ruby can see those improvements and says the team she worked with made her feel special even during crisis.
I hadn't been through this before. I now have a testimony. So you rely on those who have or those who specialize in the area. That's what I did. And it worked.
Ruby says she's now more aware of the importance of family history and early detection. Christian.
Trooper Russell Calicote's dash camera was rolling when a driver slammed into his squad car. It was a traffic stop on I-44.
Okay, we have come to the end of our program today. Just want to say thank you so much, Arlene, for your participation and the excellent information that you shared. We will bring up our MC for the day. Natalie, the floor is yours.
Thank you so much, Madam President, and Sister Arlene for all of your expertise in this field and guiding us through these tricky waters. I do have one last comment, and we will open the floor for any additional questions. Terry Cook stated that cardiac rehab is an excellent program and both of her parents participate in it. So just another plug for keeping your heart healthy. Hopefully no one will have an event that qualifies them to need cardiac rehab. But if you do, some great testimonies there.
Right.
Any additional questions from anyone that is remaining in our chat or anything? All right, I want to thank everyone for their time that they've taken on this busy Saturday and for your participation. The questions have been awesome, the comments. Thank you for the honor of letting me be your MC for the afternoon. And I would like to turn it over to Sister Tracy Huff, who is going to share a little bit of information about membership in our wonderful Mommy Bay Club of the National Association of Negro Business and Professional Women's Clubs Incorporated. And we have a great upcoming event. So I will turn it over to Sister Tracy. Thank you all for your time and attention.
Sorry about that. Good afternoon, everyone. Thank you, Mommy Bay Club Sisters, for allowing me to have a quick moment to speak on membership. Can you all hear me and see me?
Yes, ma'am.
Maybe in the chat. Okay, perfect. So Mommy Bay is constantly seeking business and professional women to join our organization to help impact our community, women in our community, children in our community. And we would love to have you consider seeking information about our organization. I can be reached. I'm going to put my contact information in the chat. I can be reached on email or via phone. I would love to talk with you individually if you are looking to have an impact in the community that can just feel good about it. And an event like today is just one of the many things that Mommy Bay Club has been doing for many years. And again, our goal is to just impact community, impact women, and impact children. Thank you so much for the opportunity. Again, I'll put my information in the chat.
I'm sorry, Madam President, may I say one more thing before
Yes.
I turn it over for you for last words.
Absolutely.
We think all of our guests are special. We do have an extra special guest that I would like to acknowledge that joined us all the way from the Northeast District under the umbrella of the National Association. We have Madam Vice Governor Nicole Graham McCathern, who has joined us. I'm sorry to put you on blast right now, but I would be remiss if I did not acknowledge
Yes.
one of our governors. So I wanted to share that. And if you would like to say anything, feel free. And now I will turn it over. Thank you all.
Am I allowed to speak?
Absolutely.
Yes, congratulations on great programming. I would love to speak to the speaker who was talking about Think Heart, Think Health. I think we can all work together on this initiative, which is a mandated program. And I thank Crystal Taylor, Madam President, for putting this on social media, and I did look at it this morning. I could be anywhere. I just hosted a fundraiser last night, so imagine I really am just getting myself together for the day. So I thank you and congratulations on your successful Think Heart, Think Health program on behalf of myself as the district vice governor for the Northeast District. And I am the member of the Mother Club, the New York Club. So I bring greetings on those two organizations. Thank you.
Thank you.
All right, everyone. Thank you so much. Thank you so much, Madam Governor. I saw that message in there. Arlene, you have been asked to participate with the Northeast District, so we'll have some conversation about that. And I will definitely get in touch with you, Governor Graham McCathern, and see if we can make something happen.
Vice Governor.
Vice Governor. If we can get Arlene's schedule to adjust, we'll have to check that out and see, but that would be an awesome thing to happen. In the way of final announcements, I'm going to go back and reshare this screen very quickly. We have some new programs that are coming up in the near future. This year, we are doing our Women's History and Founders Day celebration as a joint program, and it is the Maumee Bay Club Red Carpet Brunch. This is a shrimp and grits brunch. You do not want to miss it. We are going to have a step and repeat, a red carpet, and we are going up to Ottawa Lake, Michigan at Legacy by Arthur Hills Golf Club. Our tickets are just $65, and these funds will support our scholarships, our award ceremonies, and some of the other programs that we put on every year to make sure that our community is moving forward with a purpose. If you are at all interested in receiving a ticket for this or getting a ticket, please put your information in the chat. We'll be sure to get back with you, or if you know any of the members in our club, we will have those tickets available to sell very shortly. As you see there on the screen, our keynote speaker is Mrs. Crystal Harris Darnell, who is from the Toledo Club. So all of our clubs are working together here. She is the Director of Diversity, Equity, and Inclusion with Lucas County Board of Commissioners. And so that is our focus this year, women who advocate for equality, diversity, and inclusion. It is going to be a program you don't want to miss, and some great food, by the way. In addition to that, we are awarding approximately 6 scholarships at this event. And so you'll see that scholarship application. If you would like the link to the scholarship application, we will make that available. We have scholarship application open until March the 31st. And so if you would like to get that scholarship application, we will send that out as well. Just drop us a note in the chat and we will make sure that you can get access to that. And then you heard Arlene mention New Perspectives Sober Living. New Perspectives is a program or a business that Arlene started a few years ago and has been working diligently to make sure that she can impact the lives of men in Northwest Ohio. They are an aftercare program. And what that means is when you have someone who's gone through inpatient treatment, outpatient treatment, been talking to counselors, and they're getting ready to be released, but they're not quite ready to go back into that home environment or that space where all of those triggers are still there. That's when they call on New Perspectives Sober Living. They are open for business with a house that is absolutely gorgeous. They have 5 adult male beds there. And so if you know anyone who is ready to take on a sober lifestyle, they've been through the process and they're not quite there yet, make sure you do a referral, write that name down there, that website, newperspectivessoberliving.org. You will be able to get them in contact with Arlene and her team. I know a few of the team members were here as well. And Arlene, just as she did this excellent program today, she will take excellent care of the young men, old men, middle-aged men in your life who are looking to live a sober lifestyle. We have some women in our club who are doing amazing things. I am blessed and pleased to be serving in the position as president for the next year. And our club is just dynamite. One of the ways that our club is dynamite, I just have to tell you, let me stop this screen and come back. We have a prospective member who has joined the team and gotten to an amazing start. Miss Shanina Cooper is a prospective member. As our prospective members, and as Miss Tracy Huff discussed, we are always looking for dynamic women to join our ranks. And we have a very interesting prospective member process. We bring our members in and then we put them through some programs, some meetings. They get to work with us and then see if this is a good fit for them, and if we are a good fit for them and they are a good fit for us. And I just have to publicly thank Miss Shanina Cooper.
Yes,
She's a
thank you.
prospective member. She is coming in,
Awesome.
hitting the ground running. Thank you so much, Shanina. The only reason I didn't have you up on that first screen because I didn't have a picture that you had approved. So I was like, I'll bring her on at the end. Shanina, you have any words to say?
No, that is okay. I am here for the team. So, whatever I can do to chip in on any occasion, I'm here for it.
Thank you so much. Well, everyone, this has been a great day. Arlene, again, I want to say thank you to you for your excellent presentation. So many notes, so much information. We are recording this, and so all of our people who registered and came, you will get a copy of this recording. Once we get it fleshed out, we'll also have it on our Facebook page. And we have a new website that will be launched very soon. And so we will also have this program listed there. Just want to say thank you so much to everyone for participating, asking excellent questions, sticking with us, or popping in when you can. We know everyone is super busy. That's why we wanted to record it and make sure it was available. Thank you so much, everyone. Have a fabulous Saturday, and make sure that you get to the heart of things. Thanks, everyone.
Thank you.